Chapter 11, Research Evaluation and Assessment, Part 2. Evaluation and Needs Assessment. It is important as human service professionals that we undertake the role of evaluating the programs which we use to serve our clients and understand the possibility of assessing the needs and prioritizing the needs of an organization or the clients that we serve. Evaluations tell us how well something has been done and has the program been effective. There are two main types of evaluation. These include formative and summative. Formative process evaluation includes assessment of a program as it is going on. This often includes verbal and anonymous written responses from participants and staff members who are participating in the services that are being provided. Summative or outcome evaluation include assessments of a program after its completion to decide if it is worth repeating again in the future. Formal assessment procedures can be used, and results can be shown to funding bodies or agencies to seek additional funding to continue the program or to reproduce the program and run it through another cycle. There's more information about summative evaluations on Table 11.3. A needs assessment is used to help determine the needs or gaps that currently exist within an organization or within the services that are being provided to a specific group of people. It's used to improve existing programs, services, and agencies. Generally, with a needs assessment, data is collected and information is collected through surveys, interviews, and other interactions that occur. The results are used to form a plan of action to increase the amount of services and fill in some of the gaps that have been identified. And it generally includes descriptive statistics to report information that has been collected. Human service professional and program evaluation. Many of us have heard the term data-driven decision-making. In these days of accountability and data-driven decision-making, you will be asked to assess a program and to look at the needs assessment to show that what you are doing is working with the clients that you are serving. Many of us have seen budget cuts in years, and if you have a good needs assessment and a good program evaluation, it gives you a leg to stand on when you go before administrators, funding agencies, in order to request additional funds or to continue the program that you are working in. So it's very important that you collect data both for a needs assessment and for program evaluation as a human service professional. Defining assessment. This includes evaluative procedures that yield information about a person, and there are many kinds of assessment techniques. For a couple of examples, look at figure 11.2 and 11.3. Assessment of ability. This is achievement and aptitude, cognitive domain. Achievement tests measure what a person knows. An aptitude test measure what the person is capable of. And you can see examples of this in the text, and so it's important that you understand the difference between achievement, what the person knows, and aptitude, what the person is capable of. Additionally, there's the assessment of ability and personality assessment. These are further assessments that you can give to individual clients to learn more about them and their personality or the abilities the client has. So that you can provide the best services for that client while working within their ability level and working with their strengths or the personality that they have. Informal assessment procedures. These include everything from rating scales to observations of the client in their natural setting, classification systems, environmental assessments, which include collecting information about the client's home, school, or workplace, usually through observation or self-report. Sometimes this will include checklists. Records and personal documents, looking at auto biography, anecdotal information, biographical inventory, cumulative records, genograms, journals, diaries, school records, behavior charts, any kind of documentation that you can receive on your client. Performance-based assessment uses real-world assessments, for example, what a person might actually do on a job, to assess for ability instead of a traditional cognitive-based test. When we talk about performance-based tests, these are the kinds of tests that occur within a workplace on a regular basis to assess the employee and the work that they are producing. And we can also use it as a human service professional to understand our clients better and to understand their performance on the job. Clinical interviews. This is something you'll learn about extensively throughout this class. This includes goals, which gains an in-depth understanding of the client, sets the tone for the assessment process, helps desensitize clients to discuss the discussion of intimate information, can assess nonverbals for clients, and gives clients and helpers the ability to see if they can work together. There are different types of clinical interviews. These include structured, unstructured, and semi-structured. A structured interview is very scripted, and every question is pre-written, and the protocols are very specific, meaning the instructions to the person conducting the interview and to the person who's being interviewed. In an unstructured interview, there might be some themes or some points that you're asked to cover, but it's not the same questions asked of every person who you work with. It's kind of less structured and more informal. And as semi-structured is just like it sounds, a combination of the both. There will be some questions that are structured and written out and verbatim, but there's also some room for the person conducting the interview to ask follow-up questions or ask additional questions that they feel are pertinent to understanding the client better and collecting the information that's needed during the clinical interview. Different types of assessments include norm reference, criterion reference, standardized, and non-standardized. In norm reference assessments, the individual can compare his or her score to an average score of the peer group. So these are norm reference tests, including things like the STAR test in Texas. The criterion reference assessment techniques assess specific goals or criterions to be reached of an individual. This is more like meeting the TEKS or understanding whether we are on track to cover specific topics or material, and there's a checklist that you're assessing how much of the information on that checklist does the person understand. Standardized tests are procedures administered in the exact same way and under the same conditions each time the test is conducted. Think SAT, ACT. Non-standardized assessments are procedures that may be administered in different ways under different conditions each time. Tends to allow for more flexibility, but then there's less validity in the outcomes of the assessment. Basic test statistics. The relativity of scores, how a person does, is relative to where they score relative to themselves over time, where they score relative to others, and how they feel about the score. Is it a good representation of the work that they've done, or what they understand, or their knowledge? Standardized tests usually use measures of central tendency, mean, median, and mode, and the measures of variability, such as standard deviation, to describe where a person scores. Many times they can see where they score in comparison to a specific population or group. Test worthiness, we need to consider validity, reliability, practicality, and cross-cultural fairness. For validity, does the test measure what it says it's going to measure? There are 4 types of test validity. These include content, concurrent, predictive, and construct validity. For reliability, is the test measuring what it's supposed to measure consistently? If I were to take the same test over and over without me changing, would I score about the same? There are 4 types of reliability: internal, consistency, split half, parallel, test and retest. Practicality: is the test practical to give in terms of the amount of time, cost, and focus of the instrument? And cross-cultural fairness: is the test relatively free from bias? Does it predict well for all groups? An example of Griggs versus Duke Power Company: tests used for hiring and for advancement at work must show they can predict job performance for all groups. A couple of interesting things when designing research studies or when conducting research: practicality is really important. There are many times that there are scholars who don't understand the fields or the people that they're working with, and they will want to collect lots and lots of information so they can do a major research study. But the practicality of getting a 15-year-old who is at risk or who is using drugs to complete hours of assessment is not very practical. And so many times they have to scale back the ideal research design for something that's actually practical. A 15-30-minute research study that they can conduct and collect information from a student. The human service professional's use of assessment techniques. APA adopted a 3-tier system for deciding who can give tests. Level A and some level B are associate and bachelor level individuals who have some knowledge of assessment and are thoroughly versed with the testing manual. Level B are individuals with a master's degree that have taken a test and measurement course. Some personality tests and career tests are included in this level. And level C, a minimum of a master's degree and advanced training, such as predictive tests and intelligence tests. It is important to have adequate knowledge of different assessment and instruments and adequate knowledge of how to administer those instruments. The effective human service professional understands that research, evaluation, and assessment are not to be feared, but are tools to help progress the development of new ideas and new programs, and to understand better the field as a whole, our clients, and the programs that we're providing to them. Ethical, professional, and legal issues. A couple of ethical issues that will be covered here are informed consent, the use of human subjects, and proper interpretation and use of data. If you're conducting research as a student at Houston Baptist University, you must complete the Ethical Research Training, which is currently CITI training, CITI, and it is free for students at Houston Baptist University to complete. And they must complete an application to the IRB to conduct research. For informed consent, a client has the right to know the purpose and nature of all aspects of their involvement with the helper, including when he or she will undergo testing or be involved in research. Second is the use of human subjects. And again, if you're going to do any kind of research with human subjects while you're a student at Houston Baptist University, one of the ways we protect our human subjects is by requiring you to receive IRB approval. And then there's the proper interpretation and use of the test data. Human service professionals should know the limitation of what kinds of assessments they can give and research they can undertake. They should always see assessment and research in a broad perspective. It tells you a small piece of the information about a person or a group. Be careful about jumping to conclusions. The effective human services professional understand the main purpose and research program evaluation and assessment is to benefit our clients. They understand that research, evaluation, assessment is always evolving and changing. And effective human service professionals want to participate in some fashion in the use of development of new research, evaluation, and assessment tools and techniques, whether that be to benefit their clients, to be data-driven and collect information so they can better their programs, do program evaluations, or seek additional funding, or to provide information to the field as a whole and to add to the body of knowledge for the field of human service.